See, insulin is a vital treatment for diabetes, especially type 1 and advanced type 2. However, it's well documented that insulin therapy can lead to serious weight gain, and this is due to several mechanisms. Today, we're going to be discussing a topic I get in my office all the time. So often I have patients come in, especially when they're trying to lose the last 10 pounds, and one of the issues that comes up is maybe a medication they're on that they feel is really hindering the progress. And sometimes this medication is actually something that does lead to weight gain. And oftentimes someone will be trying to lose weight and they'll say, I'm doing everything I think I should be doing to lose the weight, but it's not coming off. And they'll ask me, Dr. Elamir, is there anything I can do? I'm doing everything right. And sure enough, maybe there's a new supplement or medication that maybe is hindering their weight loss efforts. And the reason it's important to kind of know this is because there's things you can avoid. There's other medications, usually often even in the same class, that can help. So before we dive in, let's review, with diabetes and obesity and how they're interconnected. And then we'll dive into how these medications are affecting them. So diabetes is a chronic condition characterized by high blood sugar levels, either due to the body's inability to produce enough insulin or effectively use the insulin it produces. And there's the two main types, type 1, type 2 diabetes. And type 2 is more commonly and often associated with obesity. And then obesity, on the other hand, is defined as having excess amount of body fat. And it's not just a cosmetic concern, it's really a medical problem that increases our risk for various diseases and health problems, including heart disease, diabetes, blood pressure, and certain cancers. Now, diabetes and obesity are very closely linked, right? And obesity is a major risk factor for developing type 2 diabetes. And especially my patients and clients, they have family members with type 2 diabetes. They're really more conscious about their weight because they know this will directly impact that. And that's how this topic comes up so much, especially when someone develops fat around the abdominal area. They become more resistant to the effects of insulin, which can lead to the higher sugar levels. So today we're really going to dive deep into how these medications are prescribed for various health issues and how inadvertently they can worsen the conditions. And it's so funny, as I was writing this podcast, oftentimes I'll talk to my mom, Michelle. I call her Michelle. I don't know where that came about, but I don't call her mom anymore. It's Michelle. I don't know. She's such a kind of personality that when people talk about my mom, they go Michelle, and just kind of stuck. Anyway, I was talking to Michelle, and Michelle is on a blood pressure pill. And I guess, ethically, as her daughter, I'm not really supposed to be her doctor. But I was looking at her medications, and she was talking to me, and she was on a medication that we'll be mentioning later that does lead to weight gain. And she literally was so upset with me for not telling her earlier. And I thought to myself, okay, I better record this before we get into any trouble with Michelle. So Michelle, this episode is for you. Anyways, so the things we're going to be discussing is specifically the medications to be cautious about, the alternatives that could be better, and the essential questions you should be asking your healthcare provider to get the most out of your session. So when you understand this, it's going to give you all the tools you need to switch this up if you want to switch it with the guidance of your healthcare provider. So again, our goal today is not to tell you all the information, but really to give you enough information that you can navigate the treatment options more effectively. And we'll be citing several studies throughout the podcast to provide you with the most accurate and up-to-date information. Okay, so let's dive into our first topic, the medications that can worsen diabetes and obesity. So first up is insulin and oral hypoglycemics. See, insulin is a vital treatment for diabetes, especially type 1 and advanced type 2. However, it's well documented that insulin therapy can lead to serious weight gain. And this is due to several mechanisms. One, it's an anabolic drug. So it has anabolic effects on the body that promote fat storage and the reduction of glucosuria, which is basically peeing glucose in the urine. And this decreases the loss of calories in the urine. See, studies have shown that weight gain associated with insulin therapy all across the board. So I'll list some studies here, and they saw that just weight gain was the most common side effect of the treatment, often complicating the diabetes and increasing cardiovascular issues. And this is particularly problematic as excess weight worsens the insulin resistance that you're trying to deal with anyway. So it's a very vicious cycle. The other thing is certain oral hypoglycemics, like the sulfonylurea class. The sulfonylurea class is made up of drugs like glipizide, glyburide, glimepiride, and also the thiazidinone class, which are also associated with weight gain. Those are fallen more out of favor as of late with the newer medications that are around, but a lot of people, due to insurance issues of what they will cover, will not cover other medications yet, and so they're still stuck with these older drugs. So the sulfonylureas, they increase insulin production by the pancreas, which leads to hypoglycemia and a lot of times subsequent compensatory eating, resulting in weight gain. Also, remember, they're making you secrete more insulin, which is contributing to the problem. And the thiazolidinediones, also known as TZDs, work by increasing insulin sensitivity, but they tend to cause fluid retention and an increase in fat mass, particularly in subcutaneous fat. So both these drugs also can lead to weight gain, even though they're supposed to be helping diabetes. So my tip for you for sure is definitely discuss this with your doctors, because if you are on one of these drugs, often there's another alternative. Because I think that's the biggest thing is they feel like when they're offered a medication, my patients or clients feel like, oh, well, doctor, just tell me, and for some people, they don't care about those kind of things, right? But a lot of us do. And it's nothing more frustrating when you're trying to lose weight to help your diabetes and then you're gaining weight because of the diabetic drugs you're given. It's just like, come on, right? You can't catch a break. So you really need to discuss this with your doctor and just let them know you want to be on weight neutral or weight lowering kind of medications for diabetes, because they are out there. And actually, although it's considered weight neutral, for some it causes slight weight loss, making it suitable alternative for many patients. See, understanding the impact of these medications on your weight can help you make the best decision. So example, metformin, actually, even though it is weight neutral, some people do say it helps them lose weight, and it sometimes causes a metallic taste in the mouth, which makes food kind of more off-putting. So those are the main medications when it comes to diabetes that cause weight gain. Other medications that can worsen diabetes and obesity are antipsychotic medications. So these medications are essential for managing various psychiatric disorders, including schizophrenia, bipolar disorder. However, the biggest drawback of a lot of these is that, particularly the second generation antipsychotics, olanzapine and clozapine, is their propensity to cause weight gain and impair glucose metabolism. See, antipsychotic medications like these are known to increase appetite and lead to significant weight gain. And this weight gain is particularly concerning because it can increase the risk of developing metabolic syndrome, which includes a cluster of conditions such as increased blood pressure, high blood sugar, excess fat around the waist, and abnormal cholesterol levels. These factors contribute to the heightened risk of cardiovascular disease and type 2 diabetes, which definitely isn't going to help anyone's mood. So the reason why you have weight gain associated with these antipsychotics, it's multifactorial. See, these medications alter neurotransmitter levels in the brain, such as serotonin and dopamine, which regulate appetite and satiety. Additionally, they may impact insulin sensitivity and glucose metabolism directly, leading to higher sugar levels. So example, olanzapine has been shown to increase insulin resistance, even in the absence of weight gain, further complicating its metabolic profile for those taking the medication. And actually, a really good psychiatrist will often refer them to endocrinology when they start people on these medications, knowing this may happen, because often we can pair this with another drug to counteract those effects, or if they haven't tried other medications, they may try something else. So again, this just highlights the importance of communication. So if you don't feel comfortable going to your provider, ask your endocrinologist or ask your primary care provider to discuss this with your psychiatrist who's prescribing the medication. Because I understand it's so awkward to sometimes have to bring the stuff to one doctor to communicate with the other doctor, and it's too much. So as long as you ask someone to talk to someone, often they can work collaboratively to come up with the best medication solutions for you. So the next question is, are there other medications with a lower risk of weight gain and metabolic effects? And what strategies can you do with this when you are on antipsychotic medications? And yes, implementing lifestyle interventions such as a balanced diet and regular exercise can mitigate a lot of these effects, maybe monitoring your glucose levels if needed. But being proactive about this and asking about the side effects is key to finding the provider most suitable for you. Another class to discuss is the antidepressant class of medications. They are the cornerstone of treatment for various mood disorders, including depression and anxiety. However, a common side effect, particularly with the tricyclic antidepressants and certain selective serotonin reuptake inhibitors, is weight gain. See, TCAs such as amitriptyline, nortriptyline, and some SSRIs like paroxetine and sertraline are associated with weight gain. And this weight gain can complicate the management of obesity and diabetes, and can lead to worsening insulin resistance and high blood sugar levels. And the hard part is that the person who's taking these medications is already suffering from depression. So things like weight gain can even worsen that. So it's something to be very conscious of. So this weight gain linked to these medications is believed to result from several factors. See, TCAs can cause sedation and increased appetite, leading to higher caloric intake. They affect neurotransmitters like serotonin and norepinephrine, which play roles in appetite regulation and metabolism. Similarly, certain SSRIs can do the same thing by increasing appetite and altering metabolism, although the mechanisms are still not fully understood. However, there's been tons of observational studies on this. In one study by O et al., they indicated that weight gain associated with TCAs and some SSRIs can be substantial and detrimental. I think it's often kind of said by physicians that it doesn't actually cause much weight gain, but I call nonsense on it. I've seen so many patients who I've been seeing for years who then had everything controlled and then went on these medications, and then all of a sudden they did have weight gain. So I do think this is person to person, but I do think it's a little bit ignored in the medical field. And honestly, that's detrimental to people who are really struggling with their mood. So I don't want you, if you are suffering from depression, to avoid these medications because of weight gain. What you really need to do is be forthright and honest with your physician and let them know, are there any antidepressants that are available that are less likely to cause weight gain? Or what are weight neutral alternatives? And often they'll tell you about other medications such as bupropion, which is an atypical antidepressant that has been shown to have minimal impact on weight and may even promote weight loss. Or another alternative is fluoxetine, which is also an SSRI that tends to be weight neutral and can even result in modest weight loss in some individuals. See, in addition to selecting a weight neutral antidepressant, you also need to implement lifestyle changes because as your mood changes, the way you eat might change. So by being regularly physically active and eating a balanced meal, you may be able to mitigate these effects. So monitor your weight regularly and discuss any concerns with your healthcare provider to help manage these side effects. The next drug class on the list honestly gives me about a quarter of my patients in the office. So corticosteroids, okay? So steroids, they're a powerful anti-inflammatory medication used to treat a variety of conditions. And because the variety is so large, many people are affected by it metabolically. See, they treat things like asthma, rheumatoid arthritis, lupus, and while effective, long-term use of corticosteroids always leads to significant side effects. And these include weight gain, increased appetite, osteoporosis, elevated blood glucose levels. So these corticosteroids like prednisone, dexamethasone can cause very significant weight gain, primarily because they increase appetite and changes in the fat. Actually, just to backtrack a little story here, my daughter, when she was a baby, she was failure to thrive and had multiple surgeries to get her better. And thank God for those pediatricians and surgeons that helped her so much when she was young. But after the surgeries, they'd often give her steroids. And we would think she was getting better because while she was on the steroids, she was just eating so much. And then after the steroids wore off, she'd all of a sudden lose weight again. And we realized, oh, nope, still got a problem here because the steroids were that good at decreasing all the inflammation and things that were going on with her at the time that it made her just so hungry and she was able to finally eat. So steroids, they're kind of like this necessary evil, if you had to give it a phrase. They really are powerful and so helpful and have saved so many lives. But over time, if they're chronically used, these medications absolutely lead to the development of things like central obesity and fat accumulation, especially around the abdomen. See, steroids, they stimulate appetite, leading to a higher caloric intake, and then they alter the metabolism of things like carbohydrates, proteins, and fats, contributing to the fat deposition, particularly in the abdominal area. See, moreover, corticosteroids can affect the body's sensitivity to insulin, leading to higher blood glucose levels and increased risk of developing and worsening diabetes. There's multiple studies illustrating the metabolic complications associated with long-term steroid use. Those in the study showed how these medications lead to significant weight gain and impaired glucose metabolism, emphasizing the importance of careful monitoring and managing these side effects. So, when using steroids, it's very crucial you manage the dose and duration of the treatment carefully. And ask your healthcare provider, can we use the lowest effective dose to manage my condition? Or are there alternatives with fewer metabolic side effects? Now, unlike the other classes we discussed, steroids often don't have another alternative. Things like NSAIDs, like ibuprofen, or disease-modifying anti-rheumatic drugs like DMARDs could be suitable alternatives in managing inflammatory conditions. Additionally, incorporating lifestyle modifications such as a balanced diet, regular exercise, can help mitigate these side effects. So, in addition to that, your endocrinologist, if you find it is affecting your sugar that much, will often put patients on a separate regimen for only when they're on steroids. So, I have a slew of patients where they come from a pulmonologist's office. Like my dad, he's a pulmonologist, so is my husband. So, I have a lot of patients who have chronic obstructive pulmonary disease, and they happen to be on a lot of steroids when they have exacerbations of their disease. And if they're diabetic, often I'll put them on a regimen that's different when they're about to do steroids. So they know what the day they're going to use steroids and when it starts to taper off, what to do. And this proactive approach helps regulate the blood sugar levels. By really understanding alternatives to this or how you're going to deal with the sugar when it does go up, you really stop a lot of the complications that can happen with steroids. So to wrap up this section, I did want to talk a little bit about medications that are more weight neutral and alternatives. So metformin, which we discussed, is the most common prescribed medication for diabetes, and it's well regarded for its effectiveness in controlling blood sugar levels without causing weight gain. It's unique because it is weight neutral and it does cause slight weight loss, and it's particularly beneficial for those who are overweight and obese looking to manage their diabetes without issues of weight gain. And it works, by reducing the amount of glucose produced by the liver and increasing the sensitivity of the muscle cells to insulin, which helps lower blood sugar levels. So unlike other diabetic medications, metformin doesn't increase the insulin level, which is why it doesn't cause the weight gain. And there's lots of studies on this. It really showed the benefits of metformin metabolically. It showed how it has a reduction in weight or at least no significant weight gain, making it very suitable for those with issues with obesity. Because you have to remember, with those with prediabetes and diabetes, about 80 to 85% of them are suffering from some type of weight management issue. So this could be a good alternative for those medications. Another class of drugs that is particularly helpful with weight loss as opposed to weight gain. So then there's the GLP-1 agonists, such as liraglutide, semaglutide, which mimic the action of GLP-1 hormone, which is involved in glucose metabolism. And they enhance the secretion of insulin to respond to meals, but suppress the release of glucagon, a hormone that raises blood glucose levels, and slow gastric motility, which helps increase the feelings of fullness and reduce appetite. So the highlights of the GLP-1 agonists for promoting weight loss and glycemic control. There's a study by Goosen et al. In 2022 really looking at this, looking at the benefits for both glycemic and weight control. And they looked at several clinical trials demonstrating that patients treated with GLP-1 agonists experienced significant weight reduction and better glucose management compared to those on other diabetic drugs. So depending on your insurance, if you're a diabetic, the big medications that are on the market now are Mounjaro, which is a GLP-GIP combination, or Ozempic, which is just a GLP-1 agonist. There's also liraglutide, which is often prescribed by certain insurance companies. So for diabetes, those are a no-brainer. And then if it's for obesity, well, then the drugs, Mounjaro has a sister counterpart called Zepbound, and the drug Ozempic has a sister compound called Wegovy. So they're both the same drug, right? So for each of them, they're just branded differently. One's for diabetes, one's for weight loss. But the idea is that depending on your insurance coverage, you may be qualified for one versus the other. Regardless, these medications, if you are struggling with weight, would be a better option than insulin and the sulfonylurea class because they don't cause weight gain. So for example, liraglutide has been shown to reduce body weight by about 5 to 7%, where semaglutide can even lead to more substantial weight loss, and Mounjaro even more than that. But they can cause side effects such as nausea, vomiting, diarrhea, particularly at the start of treatment, and the side effect often diminish as the body adjusts to the medication. I did do an episode where we talked about those medication side effects, so maybe check that out and you can go really deep into that there. So another diabetic class of drugs that's often overlooked for weight loss is the SGLT2 inhibitor class. SGLT2 inhibitors are sodium glucose cotransporter 2 inhibitors, and they are another class of medications that are effective for diabetes. See, the way they work is they actually have you pee out the sugar you eat. So the SGLT2 inhibitors, which include canagliflozin, dapagliflozin, and empagliflozin, and honestly, I just like the brand names better because they're easier to say. Jardiance and Farxiga and Stiglatro, those are your big ones on the market right now. So those three, they work by preventing the kidneys from reabsorbing glucose back into the blood. And instead, they have you excrete it through the urine. And this mechanism not only lowers the blood sugar levels, but they lead to caloric loss because you're literally peeing out sugar. So often I'll have people say, oh, I'm not on Ozempic. Why am I losing weight? And then sure enough, they're on one of these medications. And one plug that I will throw in about this class is with my patients is I have them take it about actually a half hour before breakfast. Some people take it in the morning after breakfast, but I find when they take it before, I notice the weight loss is even more if that's something that you're wanting, and the glucose levels don't spike when you do it this way. So it's not for everyone. See, when you're peeing out sugar, this can lead to UTIs and yeast infections because yeast love sugar. So I will say these medications do have side effects and they are not tolerated by everyone, but if you're between the medications, this is one that's absolutely weight neutral or maybe even a little bit of weight loss. So now I wanted to go over medications that aren't necessarily diabetic medications, but medications that often diabetics use due to things like heart disease and stroke. So beta blockers are commonly prescribed for managing cardiovascular conditions like hypertension, heart failure, arrhythmias, but they have the potential to increase insulin resistance and cause weight gain, complicating the management of diabetes. So beta blockers, they work by blocking the effects of hormone epinephrine, also known as adrenaline. And they reduce blood pressure and heart rate by doing this. But they can also affect your metabolism, leading to weight gain and increased insulin resistance, which is concerning for those with diabetes and those at risk for developing diabetes. See, weight gain associated with beta blockers is due to several factors. One, they decrease the body's metabolic rate and reduce energy expenditure. They also cause fatigue and reduce physical activity levels and contribute to weight gain. And additionally, they also impair insulin sensitivity, making it more challenging to deal with blood sugar. Studies have shown that certain beta blockers are more likely to do this. So example, non-selective beta blockers like propranolol and older beta blockers such as atenolol and metoprolol are associated with high risk of weight gain and insulin resistance. I can't tell you how many people are on metoprolol. And I'll ask them, because metoprolol and another drug, carvedilol, are both equally used after something like a heart attack or heart disease. But often people are just on the metoprolol, where carvedilol is so much more weight neutral. See, the impact of your metabolic health can be very significant, and if you're already struggling with diabetes and obesity, this makes that even worse. So when managing cardiovascular conditions, it's important to consider the metabolic effect of the beta blocker class, because there absolutely is alternatives for this class. See, the more selective beta blockers like carvedilol, nebivolol, bisoprolol tend to have lesser impact on weight and insulin sensitivity. But metoprolol, although effective for managing cardiovascular conditions, is definitely associated with weight gain and insulin resistance. So you really need to watch this carefully. See, the reason drugs like carvedilol don't have much of this effect is because it has both beta blocking and alpha blocking properties, which can help insulin sensitivity and reduce the risk of weight gain. And then nebivolol, this selective beta blocker, also has vasodilatory effects. And this is due to its ability to release nitric oxide, which can have a positive impact on metabolic health and reduce the likelihood of weight gain. It's also why for a lot of people, it doesn't have other side effects like erectile dysfunction compared to drugs like metoprolol. So another drug, bisoprolol, which is another selective beta blocker, bisoprolol is less likely to interfere with the metabolic processes and is considered to have more of a weight neutral profile. So when discussing beta blocker treatments with your healthcare provider, consider asking, hey, which one's less likely to lead to weight gain and affect my blood sugar levels? And if they don't know, it's okay. Maybe you can see an endocrinologist who does. Another class of drugs I'd like to discuss in this topic is hormone replacement therapy. See, HRT, or hormone replacement therapy, is often used to relieve symptoms of menopause by replenishing estrogen and progesterone levels. So while they're effective for many women, HRT can have significant side effects, including weight gain and altered glucose metabolism. See, HRT involves administration of estrogen or a combination of estrogen with progesterone to alleviate menopausal symptoms like hot flashes, night sweats, and vaginal dryness. However, some individuals on HRT experience some weight gain and changes in glucose metabolism, which can complicate the management of diabetes and increase the risk of metabolic disorders. So the weight gain for HRT is believed to result from a few factors, including a change in fat distribution and fluid retention. See, estrogen can promote the accumulation of fat, particularly around the hips and thighs, while progesterone can increase fluid retention. However, that being said, I've noticed with my patients, if they're really suffering from menopause and these symptoms, sometimes actually giving hormones gives them the energy they need again to be more active. So I take these things with a little bit of grain of salt. Some people really need these hormones because the reality is women with menopause are undertreated all the time and are just expected to suffer. So I would say this one is very individually based. If you notice that while you're on this medications, you're gaining weight, and if it's bothering you, maybe an alternative can be found because there are alternatives to estrogen for hormonal replacement therapy. And moreover, sometimes treating these menopausal symptoms and preventing osteoporosis far outweigh the potential risk of weight gain and altered glucose metabolism. So it's really essential that you discuss this with your doctor and make an informed decision for yourself. And you can ask, what are the potential side effects of this medication on my blood sugar levels? And depending on your history, they may help you weigh the risks and benefits. And it has been shown that these side effects are dose dependent. So maybe your provider may even put you on a lower effective dose for the hormones for the shortest duration to manage your symptoms. So them knowing this is very, very helpful for them to make the best decision for you. And now there are other medications on the market for menopausal symptoms like Veoza that just don't deal with these kind of side effects as much. I wanted to circle back for a sec, back to another blood pressure medication that can also worsen glucose levels. And this medication is the thiazide diuretic class because they can impair glucose tolerance and promote insulin resistance. See, studies looking at antihypertensive meds have highlighted these metabolic side effects. So it's very important that you really look at the other alternatives when you are treating your blood pressure, and maybe even consider trying to treat it naturally with different lifestyle recommendations first. Now, good alternatives to these drugs are ACE inhibitors. Drugs like lisinopril and enalapril were generally weight neutral and improve insulin sensitivity. Medications like losartan and valsartan are also weight neutral and have been shown to improve glucose metabolism. There's also the calcium channel blocker class like amlodipine, but they typically don't have weight gain and have very minimal side effects when it comes to glucose. So definitely ask them about these medications because there's always alternatives. So again, keep an open communication with your provider and really focus on lifestyle management while dealing with these medications if you have to. Things like regular physical activity, a balanced diet, and controlling your blood sugar levels is critical for your health. So these changes can enhance the effectiveness of the medications and reduce the need for higher doses. So the lower the dose, even if it can cause weight gain, the less weight gain you'll have from it. So focus on eating whole foods, vegetables, fruits, lean proteins, and healthy fats, and reduce the intake of processed foods like sugary drinks, high fat, high caloric foods that are processed. Fat is okay in a natural way like olive oil, avocado, healthy fats, but not these other ones that are very processed like trans fats. And the other thing is portion control. You want portion control in regular meal times and try not to snack in between if the medication causes you to have an increased appetite. Remember, if you eat a real balanced meal, you should not need to snack in between. And the other thing is for regular physical activity. This will very much improve your insulin sensitivity and enhance cardiovascular health. So aim for at least 150 minutes of moderate intensity aerobic exercise per week, combined with muscle strength training 2 or more days a week. And then also set realistic goals and track your progress and seek support from coaches, healthcare providers, family, or support groups, because this can absolutely affect your success. See, the other thing is implementing stress management techniques, because if you're thinking about all these things going on, it can be quite stressful. So things like mindfulness, meditation, adequate sleep are very important components. There's no doubt that lifestyle interventions absolutely help when it comes to diabetes and obesity. So understanding this and taking charge of your health is absolutely the best thing you can do. So when I say I want you to get goal oriented, I want you to set realistic goals. Okay. So that could be increasing your steps or water intake, and do it maybe like I'm going to increase 5% this week, 5% more the next week with my water intake or step intake. I want you to prepare balanced meals so you avoid unhealthy food choices. And I want you to focus on staying active and monitoring your progress. And that way, if you're monitoring things while you're starting a new medication, you can see if you're having that adverse side effect. And if you're not, you don't have to worry about it. Just because it says that this drug leads to weight gain doesn't mean you have to have weight gain with it. Every person's different and everybody reacts differently. Yes, there's a trend with these medications, but if a medication is particularly helping you in something that you've had a lot of struggle with, there is ways to get around this. So before we finish, I want to discuss key questions and topics I want you to bring up in your visit so that you take control of what you're going to be on. So I want you to ask, are my current medications still the best choice for managing my condition? Often doctors get fatigued by seeing so many patients, and reminding them of why they were on the drug in the first place could be a good reminder that you may not need that medication anymore depending on your lab results. The other question I want you to ask is, has there been side effects from my medications and how can we manage them? The next question I want you to ask is, what do my recent lab tests indicate about my diabetes and overall health? Because usually on that typical panel they get for you every year, they'll check your lipid panel, your sugar, so you'll be able to see, is it affecting your metabolic parameters? The other question I want you to ask is, how can I further improve my diet and exercise routine? And for them to know what specific goals to give you, you really need to write down what you've been doing so they can give you a perfect SMART goal to set on what to do next. And then the other thing is, and when I say SMART goal, I don't mean just like, oh, it's a SMART goal. SMART goals are specific goals, and we'll get into it in another lecture, and we'll get into it in another episode. But SMART goals are specific, they're measurable, they're achievable, they're relevant, and they have a time with it. So when you have a goal, you have to have all those elements. And if you implement that each time you see your doctor, you'll show significant improvement. Example of a SMART goal would be, I want to walk around the block 3 times a week, right? And that would be specific, measurable. I'm going to walk 5 blocks. Okay, that's a measurable amount. Is it achievable? Sure, yeah, I can walk 5 blocks and then say I was going to run a marathon. Well, that's achievable over time, but not like tomorrow, right? So it's specific, it's measurable, it's achievable. Is it relevant? Absolutely. We're talking about metabolism here. Walking is absolutely relevant. And then I'm going to do this for 30 minutes, twice a day, 3 times a week. Okay, so I'm putting a time on it, 30 minutes. So that's an example of a SMART goal. So when I say, if you want your doctor to help you make one of those, they are absolutely trained to do so. Go to them with what you're doing right now with your diet and your activity level, and then ask them to help you come up with a goal for the next time. They'll be thrilled to death if you came up to them and asked them that, I promise you. So ask them what measurements they want you to track and how often you should be checking things like your blood pressure and your blood sugar and weight. And then with them, maybe form a long-term goal. What are your goals for treatment in the next year? And what preventive screenings or preventive measures should we plan for? So to recap, today we discussed why certain medications like insulin, the antipsychotic meds, antidepressants, steroids, beta blockers, and hormone replacement therapy can worsen diabetes and obesity. We explored their effects, underlying mechanisms, and the importance of discussing alternatives with your healthcare provider. And we covered the benefits of other medications that are weight neutral or help with weight loss, like metformin, GLP-1 agonists, and SGLT2 inhibitors that can help with metabolic disease. So we also emphasized the critical role of lifestyle modifications, including diet, exercise, and behavioral changes in managing diabetes and obesity. And we discussed practical tips for taking charge when you see your healthcare provider. So my script for you is, you are absolutely in charge of your health, and so go and do it. Don't think twice. You have all the tools at your disposal. All you have to do is be brave enough to take the first step. All right, that's it for this one. I'll see you guys in the next.